Hello, this is Dr. Lakshmi Kiran. Today we'll talk about how we are going to monitor the baby during pregnancy. So the first scan we do is somewhere between 6 to 8 weeks, that is 2 weeks to 1 month after you miss your period. That's when first time we can see that there is a baby inside and it has a heartbeat. So the first scan is used to confirm that the pregnancy sac is inside the uterus. It's very important information. And as I said, that there is a baby and it has a heartbeat. So the next assessment is very important. That is to be done at around 12 to 13 weeks. That's called an NT scan or a nuchal translucency scan. At that point, the baby is somewhere between 6 to 8 centimeters in size. And that is the first time we can see certain amount of the baby's structure. So we make an initial or a preliminary assessment of baby's structure. We can give you your due date because the measurement at this point is the best way to confirm the age of the pregnancy. And the most important thing we do at this point is to assess baby's possibility of chromosomal problems like Down syndrome. So I understand all this is getting a little complicated. Chromosomes are the formula in every cell of your body. Any abnormalities in them can lead to problems like Down syndrome. So we cannot look at the chromosomes, but indirectly based on a blood test and scan, we assess the baby's probability of having problems like Down syndrome. So the next assessment happens somewhere between the 19th to 21 weeks, that is the 5th month. That's when the baby's formation is complete. So entire baby structure is assessed in detail by what is called TIFA or an anomaly scan. So we look at the baby's brain, that it has 2 eyes, nose, mouth, hands, all fingers, heart, stomach. The entire structure of the baby is assessed very much in detail, and also the growth. We also look at certain details like where the placenta is, how much fluid is there around the baby, the neck of the womb or the gate, which has to keep the pregnancy inside for all 9 months. Is it intact? So a lot of information is got at this point. So till now, these 2 scans, the anomaly scan and the NT scan, are very important, which are almost mandatory in every pregnancy. The further assessment is voluntary, depends on the situation, especially in women who have problems in the pregnancy like diabetes, hypertension, or if the doctor suspects a growth problem, they need to get their baby's growth assessment done. Usually it's done at 30 weeks and maybe at 36 weeks before delivery. This is when we measure the baby to make sure it's growing well, that it is in the right position for delivery, that is head down, how the fluid around the baby is, how the blood flow to the baby is. All these details are assessed. Hope I'm being clear. Thank you.